Hello, my name is Hunter Gashai, and today I will be showing you my fact sheet about the HIV and AIDS epidemic. What is HIV? Human immunodeficiency virus, also known as HIV, is a virus that can be spread through bodily fluids from person to person. HIV is most often spread through sexual contact. However, it can also be spread from mother to child. The HIV virus attacks CD4 cells in the immune system, weakening the body's ability to fight infections and certain cancers. Without treatment, HIV will eventually advance into acquired immunodeficiency syndrome, also known as AIDS. To the right, we have a graphic showing different ways that you can contract the HIV virus. The first way is through sex without a condom. The second way is passed from a mother to a baby. The third way is sharing injection equipment, and the fourth way is contaminated blood transfusions and organ transplants. What is AIDS? AIDS is the advanced stage of HIV infection. It's diagnosed after the presence of an AIDS-defining condition is discovered or CD4 cell count is lower than 200 cells per milliliter. There is no known cure for AIDS, but HIV medications can still help people at this level of infection. Diagnosing HIV and treating it can prevent the patient from reaching this stage. When did the HIV and AIDS epidemic start? The HIV epidemic began in the United States in 1981 in San Francisco. The HIV virus has been infecting humans since the beginning of the 20th century. Scientists believe the virus has originated in animals and jumped to humans. The most likely culprit is chimpanzees. At first, it was believed that the virus only infects men who have sex with men, but this was quickly disproven as patients who were straight began appearing. Today, 38 million people worldwide are living with HIV or AIDS. There were an estimated 1.5 million new infections in 2020, and around 690,000 people died from AIDS-related illness in 2020. The epidemic reached its peak in 2010 and has been slowly declining since then with the use of prevention and treatment practices. New infections have declined at a rate of about 30% per year. Here's a graphic showing levels of HIV infection in the year 2008 in different continents. 97% of those living with HIV reside in low and middle income countries, particularly in sub-Saharan Africa. This is due to low access to healthcare and HIV treatment. In Asia, 4.7 million people were living with HIV in 2008. In Latin America, 2 million people were living with HIV in 2008. And in Eastern Europe and Central Asia, there were 1.5 million people living with HIV or AIDS. How is HIV treated? HIV is treated using antiretroviral therapy, also abbreviated as ART. ART is taken as a daily regimen of medications. The goal of ART is to reduce the viral load of HIV to an undetectable level, meaning that HIV-positive people can no longer infect another person when undetectable. People diagnosed with HIV can prevent AIDS and live a long, healthy life if they are treating their HIV using ART. Here's a graphic showing what antiretroviral therapy does. Antiretroviral therapy, also known as ART, is the daily use of a combination of HIV medicines to treat HIV. ART saves lives, but it cannot cure HIV. As of right now, there is no known cure for HIV. ART reduces the amount of HIV in the body, reduces the risk of HIV transmission, prevents HIV from advancing to AIDS, and protects the immune system. The best way to treat HIV and AIDS is by preventing it entirely. The best way to prevent HIV is by practicing safe sex. HIV can be prevented by utilizing condoms, limiting sexual partners, and not sharing drug injection equipment. You can also take pre-exposure prophylaxis, also known as PrEP, if you are at high risk of being exposed to HIV. PrEP prevents HIV if taken daily. Certain HIV medications can be given to HIV-positive mothers to reduce risk of transmitting HIV to their child. The role of public health in the HIV and AIDS epidemic. Many public health initiatives have been used to decrease the spread of HIV. The U.S. President's Emergency Plan for AIDS Relief, also known as PEPFAR, is the most notable of public health initiatives in the HIV and AIDS epidemic. PEPFAR diverts funding from the government to fund policies supported by data-driven research. PEPFAR has saved countless lives through a combination of the several areas of public health, including health administration and policy, epidemiology, and social and behavioral sciences. In response to the HIV and AIDS epidemic, certain groups began appearing. The AIDS Coalition to Unleash Power, also known as ACT UP, was formed due to government inaction to the HIV and AIDS epidemic. It was led mainly by the LGBTQ+ community and formed in New York City in 1987. ACT UP helped those affected by HIV and AIDS by drawing attention to the epidemic, educating populations, distributing medical information, and fighting for government and medical action to fight the epidemic. Here are some sources that I used to create this fact sheet, including the HIV.gov website, the National Institute of Health's HIV info website, and the ACT UP New York website.